Have you experienced recurrent pregnancy losses? And by recurrent, I mean more than one or two. Have you had history of migraines? Do you get tired a lot? Do you have family history of rheumatic arthritis or SLE or stroke? Have you had issues of stroke yourself, especially if you're below the age of 45? And are you a female? Most of the symptoms, if they apply to you, discuss antiphospholipid syndrome. It is one of the leading causes of recurrent pregnancy losses in actually across the world, something we call the sticky blood syndrome or Hughes syndrome, discovered about 30 years ago. So in antiphospholipid syndrome, the problem is your blood is sticky. Why is it sticky? It is more prone to having clotting mechanisms, and it is this clotting that goes to the placenta and prevents the placenta from forming accurately. It prevents something we call T helper 1 cells from transforming to T helper 2 cells, and therefore you have more predilection to having platelet issues and thrombotic issues in the placenta. So if I simplify it, it means the blood in the placenta is sticky, and because it is sticky, it is not able to perfuse blood as well, and therefore the baby will die of hypoxia. So usually we see first trimester losses where there's a heartbeat and then there's no heartbeat, or we can see late trimester losses up to including stillbirths. So if you've had any stillbirths, history of recurrent pregnancy losses, it is prudent for you and your doctor to look for antiphospholipid syndrome. How do you check for it? We have 3 primary tests. We do anti-cardiolipin antibody, lupus anticoagulant antibody, and beta-2 glycoprotein antibody. If any of these are found positive, especially anti-cardiolipin antibody, then it is paramount that you put on blood thinners, which include heparin, warfarin, or junior aspirin. So in pregnancy, we combine mostly heparin and junior aspirin, and we have seen patients actually be able to carry their pregnancies to term after having up to 13 pregnancy losses. And while it is a miracle, it is sad when we see recurrent pregnancy losses. If you also have the systemic symptoms such as the migraines that I've talked about, have issues of DVT or clots anywhere around your body, or you have strokes, which you call a young stroke when you're younger, then it is paramount for you to see your endocrinologist and rheumatologist so that you may be put on sometimes lifelong warfarin. So I hope this helps someone. If you've suffered with recurrent pregnancy losses and you'd like to talk, you can book with us. We can discuss further on your particular symptoms. We can be found on our Wills for Life app, and you can book a session, or you can find us on 0719 11 66 11, and prayerfully we get solutions to your issues. Thank you very much. Bye.